Welcome to our in-depth look at bladder lymphangioma, a rare benign condition affecting the urinary bladder. In this video, we'll explore what it is, how it develops, its symptoms, diagnosis, treatment, and what the future holds for those affected by this condition. The exact cause of bladder lymphangioma remains largely unknown. However, it's believed to be associated with congenital lymphatic malformations, meaning it's present at birth, even if it isn't diagnosed until later in life. Some researchers suggest a possible link to inflammation or trauma that damages lymphatic vessels in the bladder wall, leading to abnormal growth. In some cases, acquired lymphangiomas might arise after surgery or radiation therapy in the pelvic region, but these are generally considered secondary rather than primary lymphangiomas. Bladder lymphangioma involves the abnormal proliferation and dilation of lymphatic vessels within the bladder wall. These dilated lymphatic channels form cyst-like structures, often referred to as lymph-filled cysts or cavernous lymphangiomas. As these cysts enlarge, they can protrude into the bladder lumen, causing symptoms like hematuria or urinary frequency. The growth isn't cancerous, it's a benign malformation. The primary issue is the physical disruption caused by the expanded lymphatic vessels and their potential to bleed or obstruct normal bladder function. Bladder lymphangioma is an extremely rare condition. Due to its rarity, precise epidemiological data is limited. It can occur at any age, but a significant proportion of cases are diagnosed in children and young adults, suggesting a congenital origin. It appears to affect males and females equally. Given its often asymptomatic nature and potential for misdiagnosis, the true prevalence may be underestimated. Many cases of bladder lymphangioma are asymptomatic, especially when the lesions are small. However, as the lymphangioma grows, it can cause a variety of symptoms. These may include hematuria, which is blood in the urine, urinary frequency and urgency, difficulty urinating or a weak urine stream, pelvic pain or discomfort, and in rare cases, urinary tract infections. The severity of symptoms depends on the size and location of the lymphangioma within the bladder. Diagnosing bladder lymphangioma typically involves a combination of imaging techniques and cystoscopy. A urinalysis may reveal hematuria. Imaging studies like ultrasound, CT scan, or MRI of the pelvis can help visualize the lesion within the bladder wall. However, the gold standard for diagnosis is cystoscopy, where a thin, flexible tube with a camera is inserted into the bladder to directly visualize the lesion. Biopsy samples taken during cystoscopy are then examined under microscope to confirm the diagnosis and rule out other conditions, such as bladder cancer. While bladder lymphangiomas aren't typically classified into strict types, they can be broadly categorized based on their extent and location. They can be localized, involving a small area of the bladder wall, or diffuse, spreading across a larger portion. Some are superficial, affecting only the mucosa, while others are deeper, involving the muscle layers of the bladder wall. This characterization can influence treatment options. Treatment for bladder lymphangioma depends on the size, location, and symptoms it causes. Asymptomatic small lymphangiomas may only require observation with regular follow-up cystoscopies. Symptomatic lymphangiomas can be treated with various methods, including transurethral resection (TURBT), where the lesion is surgically removed through the urethra. Laser therapy, such as N-Truwig laser, can also be used to ablate the lymphangioma. In rare cases of large or diffuse lymphangiomas, partial cystectomy, which is surgical removal of a portion of the bladder, may be necessary. Sclerotherapy, where a substance is injected into the lymphangioma to cause it to shrink, is another potential treatment option. Unfortunately, there's no known way to prevent bladder lymphangioma, primarily because the exact cause remains unclear. Since many cases are thought to be congenital, preventative measures are not applicable. Avoiding trauma to the pelvic region could hypothetically reduce the risk of acquired lymphangiomas, but this is not a proven preventative strategy. The prognosis for bladder lymphangioma is generally excellent, as it's a benign condition. Recurrence is possible after treatment, so regular follow-up cystoscopies are important. Recent research is focused on understanding the underlying mechanisms that lead to lymphatic malformations and exploring novel treatment options, such as targeted therapies that specifically inhibit lymphatic vessel growth. Additionally, advancements in minimally invasive surgical techniques continue to improve treatment outcomes and reduce morbidity. While rare, ongoing research will continue to refine our understanding and management of bladder lymphangioma, improving the lives of those affected by this condition.